I've been asked to talk about sort of innovation, what we've sort of brought to patients, is how we can help improve their healthcare, not only in urology, but across the different medical specialities for patients living with cancer. So I think Liz has already embarked upon this, but I started my journey just back in 2001, so almost 25 years ago now. I've been qualified for almost 20 years. It all culminated in sort of 2020 when I went to Royal Marsden and did my Urology fellowship. I'm in as appointed as consultant at Royal Marsden. Then at that opportunity I had a sort of crossroads in my sort of life about where to go and what to do next with regards to my career. I was very early on, and so the opportunity came here to come to Northampton, and I was approached by the medical director, or now current medical director, who wanted to sort of deliver a vision with regards to treating patients and developing a robotic surgical program. And through various connections, he was put in contact with me. And he said, look, just come up to Northampton and meet the team. And one of the first people I met was Liz. And after meeting her and having a conversation with her, I thought, no, this is the place I want to come to, because this is where the passion and the dedication that you've shown for patients, and this is what I want to deliver in my sort of care and going forward in my career. So I came here in 2022. I was lead for the robotic surgical program. I've been over the last few years just taken on a couple more positions as well. So questions like, what is innovation? So there's lots of different innovations. There's innovations in healthcare, innovations in science. We all know about AI coming. Now, one of the things when we talk about robotic surgery is, what is robotic surgery? A lot of people get confused, is it the robot doing the operation? No, it's not. Because if you let robots do the operation, you could end up with things like this. So hopefully that won't come like this, but as the good old Russian attempt with their robot didn't quite plan as they planned. So we're not talking about that robot when we talk about robotic surgery. We're talking about robotic assisted surgery, and in 2022, with the help from the medical director, so Mr. Namade, he managed to bring and secure funding for a state-of-the-art intuitive surgical robot, so £1.8 million worth of beautiful kit, which was to enhance patient care, not only urology, what I do, but also to try to provide the opportunity for robotic surgery for all patients with cancer across various specialities. And that was my goal, to try to develop this program. So we commenced it in March 2022, and at that point, there was only me who could use the robot. But then since then, in the last few years, we've trained up now over 13 surgeons across 4 different specialities, and we've performed to date over 1,250 robotic surgical procedures. We've now moved from one platform, one robot, to 2 robots. We've now put the second robot across onto our onto Kettering site, so that more patients can benefit from the great benefit which robotic surgery can provide. And back in 2023, this is one of our news articles where we, after our first year of our program, to celebrate the success with our patients, we had a big event with patients coming through and also their families. This is our robot in our theatre. This is our robot number 1, called Stitch. And at that point, that was 2 years ago, we just performed 280 procedures. I'd say we've now done over 1,000 more procedures since that time. So it's going really well, and say it's benefiting many patients, not only in urology, but what I do, but also in colorectal, gynae, and also head and neck cancer surgeries. And over 90% of our operations that we do robotically are for patients with cancer. So just sort of now, I think just changing tack with my presentation. So I specialise in robotic surgery and mainly kidney cancer and prostate cancer. And the next part of my presentation is moving on to the prostate cancer part of things, which I spent the last sort of 2 years of my life trying to sort develop and establish even better prostate cancer service here for Northamptonshire. Because currently, with prostate cancer, if you've got disease localised within the prostate, you get one of three options as men. You can either, on the left-hand side, you can watch it, if it's suitable, if it's a small amount of prostate cancer. In the middle, you can have it robotically removed with surgery. On the right-hand side, you can have it radiotherapy. Now these are very good options, the surgical and radiotherapy options, and active surveillance is suitable only in certain men. But then, can we do better? And over the last 5 years or so, there's been a lot of publications in scientific journals and in the press and the media with regards to, are we doing right for our men? Are we over-treating certain men and giving them worse outcomes with regards to their life and their satisfaction after treatment, be it surgery or radiotherapy? And the main issue that men experience after these radical treatments is sexual side effects such as erectile dysfunction, and also urinary side effects such as urinary incontinence. So are we doing the right for men? Are there better ways? I don't think the slide projects very well, but this is just basically summarises. So on the left, you've got active surveillance. And so you're not doing anything for the cancer, you're just watching it. So this can increase patient anxiety and patient well-being can be worsened. With the two middle columns, which are the radiotherapy treatments, often there'll be bowel and urinary symptoms. And then with the prostatectomy, there'll be erectile and urinary issues after surgery. So this is where we had a vision. And so 2 years ago now, I was approached by a very kind and generous individual who's local to the Northamptonshire area, who came to me with regards to a proposal about trying to change the way we want to treat our prostate cancer patients. So he had this treatment, which was called focal therapy, which treats his prostate cancer, but he had to go all the way down to London to one of the centres there which offered it privately. And he was going, well, why is it offered locally on the NHS for every patient? And so we embarked on a journey which started in Costa, whereby we thought, okay, let's have a vision. Let's try and develop a focal therapy service for the whole of the Midlands, and we're the first in the area. And not only develop focal therapy to treat it, but also try and diagnose our patients better and try and get a state-of-the-art diagnostic centre as well. And also increase our workforce, increase our clinical trial contribution in international research, and be a leader in the area. As we started that 2 years ago. And what's happened since then is that fast forward, we've now raised over £480,000, and that's enabled us now to purchase three vital bits of equipment, which we're now using, and started a service. So the first bit of equipment is to help with our staging and detection. So we already do fantastic imaging for our prostate cancer patients, and we do MRI scans. We've already progressed over the last few years from traditional biopsies of the prostate to more targeted biopsies of the prostate on the left. However, there is still an issue of potentially missing or overdiagnosing or underdiagnosing patients or undersampling by not hitting the right area. So that's why now we've hot off the press in a truck somewhere in France coming across to Northampton as we speak is this machine, which we've used a loan version over the last 6 months as part of a clinical trial, but we've now managed to purchase this machine so we can use it for all our patients, which is basically enables us to map accurately in 3D real-time imaging the actual lesion where the prostate cancer is within the prostate and take accurate biopsies pinpointing that lesion in order to obtain more accurate diagnosis, tailor the correct treatment for the patient, and also avoid potentially over-biopsying the patient unnecessarily. The second thing is what we call the treatment slide. And this is in 2 arms. So the first part is what we call HIFU, and the second part is what we call nano knife. It's a short video, it's a couple of minutes long. It's got no sound, so I'll talk through it. Focal therapy is an alternative treatment to treat just the prostate cancer with avoiding the side effects associated with surgery or radiotherapy. And it can be done as a day-case procedure under a short general anaesthetic, and the patients go home the same day with no cuts on the outside and just walk straight home. And what this enables the patients to do is that they can have the cancer treated, but avoiding the main side effects which are associated, which is, as we mentioned before, was the sexual side effects and the urinary incontinence. And so what this technology enables us to do is to deliver high-intensity focused ultrasound waves, as this shows now, just to treat the actual lesion itself, which is glowing in yellow like a gold nugget there. It's not quite as clear as that when you do it in reality, but that's that's the picture. You can get the concept there. And so it's a minimally invasive treatment for prostate cancer. And we've started this now for the last 5 months now. We've started this in July, this service. And there's a little picture of the machine. The second exciting technology is a more recent addition, is what we call NanoKnife. Now, this does have a video, but it's very short. This is another type of technology whereby the lesions that we can't treat with radiotherapy, the lesions that we can't treat with surgery, and the lesions that we can't treat with HIFU, we can treat with this alternative technology, which is called NanoKnife. It sounds really good. It doesn't involve any knives, and it's another form of focal therapy treatment. We managed to start our first NanoKnife this last month, and we was very successful. And so the question is, obviously, just drawing conclusions, is talk about what is innovation. We are at the forefront of technology in urology here across the Northamptonshire. With the introduction of these 3 new bits of technology, this HIFU, NanoKnife, and the fusion biopsies, we now are one of the leading centres, not only in the Midlands, but also potentially the UK, with regards to providing a whole sort of range of diagnostics as well as treatment options for patients living with prostate cancer, to enable us to give the patients the right choice for their cancer. And you may have heard, or with regards to, is this cutting edge? Yes, it is. Especially the Time magazine, every year they publish the 100 best inventions across not only healthcare but across just greatest inventions of that year. And so NanoKnife itself was actually voted as one of the Times 2025 best invention for transforming prostate cancer treatment. So what we're doing is we're not just using old technology, we're using the latest cutting edge technology for our patients, which we're able to offer. We're the only department in the whole Midlands that offer both HIFU and NanoKnife on the NHS as part of our everyday option for treatment for our prostate cancer patients. So what about the future? More clinical trials. Over the next 6 to 12 months, we'll be actively involved in not 1 or 2, but 5 prostate cancer clinical trials here, and involved with research. As well, with my robotic hat on, I'm also trying to increase our robotic surgical capacity, because our goal is to, over the next 10 years, is to try to ensure that over 90% of all our surgical treatments are treated robotically, which gives the best patient outcomes, particularly with their quality of life and their well-being afterwards. And we're also embracing new technologies, not only in urology, but of course to help all our cancer patients, no matter what tumour they've got. Thank you very much. I don't want to take up any more of your time, but please enjoy the rest of the day. I'm sure Liz has packed the schedule out, and I don't want to leave away from your coffee too much. Okay. Thanks so much.